Welcome to another edition of Dan Frequently Asked Questions. In this edition, we'll be discussing mild joint pain after diving and whether it could be decompression sickness. Keep watching. We got a question from a diver who had been diving a conservative profile at altitude but had developed joint pain, which was fluctuating, and it did seem to be a type 1 or a pain-only case of decompression sickness. Now, there are a couple of important things when it comes to suspecting joint pain and decompression sickness. First of all, if pain in a joint is aggravated by movement after a dive, then it is more likely to be a joint-related problem than a bubble-related problem. Bubble problems usually are poorly localized and usually are not greatly affected by movement. There are, of course, exceptions, but these would not be the most serious types. We are most concerned about joint pain that happens after a dive, is deep and boring in nature and unaffected by movement, because this may not only be serious bone decompression sickness, but it may even cause chronic bone death or dysbaric osteonecrosis. Now, pain in a joint after pain-only decompression sickness can last for several days, whereas typical aches and sprains usually subside fairly quickly. If the pain remains, and particularly if there are additional symptoms like skin rash, tiredness, and certainly things like weakness and tingling, it would be essential for you to get assessed right away. Now, this is post hoc, so that time has passed, but for future reference, if there is pain in a joint, it is best to have it seen to if, as I mentioned, it's deep, boring, poorly localized, and unaffected by movement. For now, the best approach if something like this were to happen would be to keep hydrating yourself well, avoiding further diving until the symptoms have fully resolved, and if pain worsens or there are any other symptoms, to seek medical attention, which may include calling Dan. If there's tingling or discomfort and it persists beyond 72 hours, you need to consult a doctor and preferably someone trained in diving medicine. Or again, call us at the Dan hotline. Until next time, safe diving.